3 years ago, I challenged our EMS Bureau to consider alternate models of pre-hospital care. EMS now makes up 85% of our call volume, and that number will no doubt continue to rise. Our department is known for being an innovator in the EMS field, and now it's time to innovate once again in order to meet the ever-increasing EMS needs of the communities we serve. Today, I am proud to announce the launch of the Los Angeles County Fire Department's first Advanced Provider Response Unit, APRU. The APRU will be able to assess minor patients in the field, perform simple interventions, and redirect patients to appropriate levels of care without the need for an emergency ambulance, transport, or ER visit. My executive team and I would like to thank everyone whose hard work made this launch of the APRU possible. We also thank you for the amazing work that you do each and every day to provide the highest level of care and compassion to our residents in their time of need.
So what is an APRU? An APRU, or an Advanced Provider Response Unit, partners up a paramedic with an advanced practice provider. An advanced practice provider, or an AP, is a nurse practitioner, a physician assistant, or a physician. So let's use our imagination for just a minute, and let's imagine that if when we went out on a patient and we recognize that this patient really doesn't likely need to go to the emergency department, what if we had a resource we could send to that patient that could assess them where they are, provide a simple intervention, and then refer the patient back to primary care or urgent care or whatever level of care is appropriate, so that patient doesn't need an ambulance transport and doesn't need an emergency department visit. That is what the APRU can offer. So who's going to be staffing the APRU? In the paramedic seat, we're going to have a combination of EMS Bureau firefighter paramedics and captain paramedics. They'll be working the unit on a rotation. In the EMS Bureau, 9 of our paramedics are captains and 3 of them are firefighter paramedics. In the advanced provider seat, we have a combination of nurse practitioners and physician assistants from the county hospitals and from emergency departments out in the community. All of the providers that we're putting in that place have extensive emergency department experience. Many of them have been working as nurse practitioners or PAs for several years. All of them have worked as registered nurses in the emergency department for a long time. So how does the APRU get calls? There are 3 ways that the APRU will come and interact with the patient. The first is if you request them. So if you're en route to a call or you're on scene with a patient that you think probably doesn't need to go to the hospital, then you can go on Blue 12 and request the APRU to respond through dispatch. Another way is that the APRU will be monitoring Blue 12 for calls in the battalion. If they believe that there's a call going out that might be appropriate for them, they will get on the radio and request to be added on to your call. The third way is what we call either a revisit or a pre-visit. So if we have a patient that we have visited before, so let's say we saw a patient and we want to do a checkup on them the next day, the APRU can create a still alarm call and go out and reassess that patient. A pre-visit is if there's a patient that is a high system utilizer, and I think most battalions have several, then the APRU can go out and try to meet with that patient before the 911 call and do what they can to prevent the call in the first place. So those are the 3 types of calls that the APRU will be responding on. So what are the shift times that the APRU is going to be working? The APRU is going to start Monday through Thursday from 0800 to 1800. And you might ask, well, why are we doing it that way when we know we get calls all the way into the middle of the night? What we're going to do is we're going to copy a model that was successful in Anaheim. We're going to mirror the launch of the APRU to match the typical working hours of the offices and clinics in the area. Because the easiest way to arrange wraparound care for a patient so that they don't need to go to the hospital is to be able to make access to their primary doctor or to an urgent care in the area so we can get them the care that they need without having to go to the ER. If you have more questions or concerns or comments, feel free to reach out to me directly, as always, via cell phone, via email, or by text.